Hi, everybody. I want to welcome you to the Resident Family Support Council meeting that we hold on the second and the fourth Tuesday of every month. And we have these meetings with the purpose of empowering people with information so that they can really understand the resources out there, material that can help them navigate this journey of long-term care, which can be very confusing. A couple of things before we begin today's presentation and conversation. We have a YouTube page where these are recorded and they're put onto YouTube. So visit the YouTube page. All you need to do is Google. You could just Google IL Ombudsman Program and it will come right up for you. And also we'll get that information put into the chat. Stephen Maxwell, who's usually with us today, usually with us working the chat, is not here today. So either that or if someone else, Karen, if you could go ahead and do that, that would be fantastic because I know you're also very good about putting information into the chat for us. That would be wonderful. So I am Lee Moriarty, and I'm with the Illinois Long-Term Care Ombudsman Program. And we bring these meetings, like I said, so that you can feel empowered. So the topic of today's meeting is actually about the Area Agency on Aging, because these exist throughout the state, and a lot of people either aren't aware of them or are aware of them, but really aren't quite sure what they're all about. So we thought that this would be a great topic to help make sure that we understand this better so we can utilize these resources. And while those of us who you may be living in long-term care, this may not be your long-term path. And so knowing these resources can be really helpful for you to be able to have that good discharge plan so you can see what is available out in your community. To have this conversation is Susan Reel, who's actually on the Ombudsman Advisory Board. So she helps us make sure that our program is doing everything that we can to make sure that people know who we are, what we do, and how we can help. So Susan, if you'd like to go ahead and unmute your microphone, I'm so glad that you're able to join us today and really have this conversation.
Well, thank you, Lee. I really was honored to be asked. I've been with the Area Agency on Aging for 38 years. And during that time, we've always sponsored the Long-Term Care Ombudsman Program. So I even directly supervised the program for a while. So the Ombudsman Program, working with nursing home residents of assisted living and supportive living, is very near and dear to my heart. So being able to speak to the group today from the perspective of resident counsel and family councils, I'm just thrilled and feel like this is a perfect opportunity for us to help connect the dots. And there's so much that area agencies can do to support, as Lee described so eloquently, the journey of navigating long-term care.
So thank you for being with us, Susan. We really appreciate this because, that's what we're trying to do here is build connectivity with these meetings. So as much connections as we can pull together for people, I think it just has such a value. And we get a lot of really great feedback from people. I got an email right before this meeting began today from somebody saying, I really need to hear this information, but I can't make the meeting. How can I get to it? And of course, that's one of the reasons why we record these so we can put them onto YouTube. So thank you.
Very good, very good. So would you like for me to step through our my graphic?
Yep, that would be fantastic. Thank you.
And then you just interrupt with questions, and I'm open to answering any questions as well. So just give me a moment here. I'll do a share. And oopsie-doo. I just need to enlarge this a bit. So,
okay, yep.
But I can't seem to find it without.
It's hard when you get these side panels up on Zoom.
Yeah, I'm so sorry about this.
Nope, we're all
okay,
good.
I needed to be a little bit more ready. Okay, there we go. Okay, so before I get started, though, I wanted to give a shout out to Betsy Beck. Betsy Beck is one of our colleagues. She's a caregiver advisor out of Fort County. So we're so happy to have Betsy Beck join the presentation today. So area agencies on aging. we, as a general network, we've been designated through the Older Americans Act, which was brought into being in 1965, the same year Medicare came into being. 1965, the Older Americans Act, identifying all the important work that and support that older adults needed in terms of improving their living situation, making sure that they had support services, making sure that they had a safe place to live, that they could live with dignity, but most of all, the making sure that they receive the services that allowed them to be as independent as possible. And those goals of the Older Americans Act are back in 1965 they were created, and they're just as important now. So as the Older Americans Act evolved from 65 to the 70s, the area agencies were created through an amendment of the Older Americans Act, and we were created along with state units on aging about 1970, 72. And so they were created to be a grassroots local entity representing local needs of older adults. So they were designed to be community-based, and we are governed by a board of directors and advisory council. We work in tandem with our state unit on aging, the Illinois Department on Aging, but we also have our charge and our mission is making sure we respond to the needs, the local needs of our older adults. So that makes, go ahead.
There is an area agency on aging for every community throughout the state, correct?
So let me show you the map.
Okay.
Can you see the map?
Yep. Mm-hmm.
So we are broken into 13 areas, 13 regions. There, the bureaucratic language is planning and service area. So many of you will hear PSA, planning and service area. So that's how we're divided up in Illinois. 13 in the entire state. The largest population-wise are in the Chicagoland area, Area 2, Area 13, and Area 12. 12 being the city of Chicago, 13 being suburban Cook, and Area 2 being the collar counties. We rank number 4th in terms of size, in terms of population, but certainly we rank number 1 in terms of geographic size. We are number 5. We are PSA 05. And then 04, PSA 04 is Peoria area. PSA 03 is Rock Island Moline. PSA 01 is Rockford. PSA 06 is the Quincy. PSA 07 is Springfield. PSA 08 is Metro East, East St. Louis, O'Fallon, Belleville. Area 9 is Vandalia and Centralia. Area 10 is Olney, and Area 11 is the Egyptian Area Agency on Aging. Think of Carbondale and Carterville. So
that's really great to see that graphic. It's very helpful for us to see where everything is. And the Ombudsman program mirrors those same regions. So know that for anybody who's looking for the Ombudsman, we use the same regions that the Area Agency on Aging uses, which can be very helpful for people to understand.
So with that, this particular local leaders brochure has some lovely graphics. So the roles that we play, we help in planning. As I mentioned earlier, we are responsible to respond to the needs of the local seniors and individuals with disabilities and caregivers. So we plan for service delivery to those population groups, and then we develop programming. Many times our programs are stated in the Older Americans Act, like nutrition, like family caregiving programs, but then there is some discretion to come up with some creative programming that I'll cover. And then we are also responsible for coordinating. We're the entity that we bring the local county health departments together with the local community hospitals together, with the volunteer organizations, and then with the service aging network, so that we can coordinate, because many times our missions are aligned, and wanting to make sure that we work together to support the client and the resident instead of working against each other. And then the other category of activity that we are responsible for, we are charged with with this particular action, is advocating. We advocate, and that's a term that the ombudsman knows very well. Advocating. We advocate not only for the rights and for the needs of older adults and residents of long-term care facilities and care partners and individuals with disabilities. We also advocate for funding. And that is, again, a requirement of area agencies on aging. And that can take different forms and forms and formats. Advocacy in terms of working directly with the Illinois General Assembly, coming up with a request for support to support family caregivers, to support reducing social isolation pilots, and then also funding to support home delivered meals. So those are what we call our legislative asks. We also, though, have advocated on behalf of nursing home residents, and more recently, East Central Illinois Area Agency Long-Term Care Ombudsman Program, Ryan Ganaway and Angie Baker, our regional ombudsman. They were very effective in communicating the needs to increase the personal needs assessment for Medicaid residents in long-term care facilities, from a $30 monthly allowance to a $60 monthly allowance. So you can see the advocacy can take, as I say, many shapes and forms, but we also need to include our nursing home community, residents in the nursing homes, as part of that overall advocacy picture. So there's an example where we had some positives there.
And that's good to hear that the advocacy, the work that you're doing may be happening at that local level, but it also can affect at the state level as well, such as the personal needs assessment increase, which was phenomenal work that was done, because this is something that has been needed for so long. People have been only getting $30 a month when you were on the public assistance program forever. And to be able to get that money raised was just such a large movement for all people who live in long-term care. So we really appreciate the work that happens locally that can affect the entire state collectively.
And we have to give Ryan Ganaway, our community ombudsman, recognition, because he worked with residents in facilities in Champaign and Douglas counties, and they actually and came up with a letter that they wrote to their legislators. And that was where it brought awareness in terms of the need. And it was a beautiful thing. It was really wonderful. So, but there's more work to be done.
But grassroots works. It does work. And that's a wonderful message to hear.
So the Older Americans Act requires us, again, to provide this wide range of long-term care services and supports. So, this language, what does that mean? Well, it just means help to serve older adults so they can remain in their own home. And we have to make sure that we put in place a strong local delivery system tailored to the community, so that we do enter into contracts and grants with community partners in the provision of this service. And that also, reinforces our ability to coordinate with so many different players, as well as be creative in that development. But it is, and we just got through with our first county conversation. We were in Pontiac and Livingston County to actually present on all the services that are provided in Livingston County, to then get feedback on how we can improve. And so we had Angie Baker present on behalf of the Regional Ombudsman Program on how we can improve our ability to better serve residents in the community. So that was also very helpful to be able to be a part of that. So now I know I'm jumping around. This is a graphic that's not the easiest thing to manage. So let's see here. So a couple of other things that we wanted to share with you are our core services. So the Older Americans Act has a template of services they want to see provided through the funding through the Older Americans Act. And the state, Illinois, the Illinois General Assembly has been very supportive. They're very supportive of the long-term care ombudsman program, as you know, but they've also been very generous to support our home delivered meal program. And the Illinois General Assembly has, for the first time in last year, fiscal year 2023, they provided state support to support our informal family caregivers, meaning I was a caregiver to my mom and my dad. That many of you in the audience have probably provided caregiving. So the state funding for the first time last year has continued this year. It actually we want to match what we're getting from the federal level, but that funding has certainly helped us do a better job of reaching out to caregivers.
Can you
So
speak to that a little bit more? Can you speak to what that work looks like? Because I know
exactly.
many people on this call are caregivers. That's who and even though their loved one is in a nursing home, they still have that role of being a caregiver. That doesn't go away just because the person may have moved their location. They're still there to support their loved one, and many of them are still. They think they're no longer a caregiver, but they truly are because they're the person who is giving quality to that individual's life, and they're there to hold their hand and support them as they're navigating the new place that they're living. So you're still considered a caregiver. I don't want people to lose that concept.
So the National Family Caregiver Support Program was included in the Older Americans Act amendments back in 2000. And in 2020, fiscal year 2001, we actually implemented the National Family Caregiver Support Program. So every area agency on aging across the nation receives funding to provide support to the informal, non-paid family caregiver who is basically supporting their loved one in their home, okay? Mm-hmm. Knowing certainly that the relationship between a family member and their loved one in the facility is still a caregiver. This program is designed to help with support groups, helping with training and education so they can become a better caregiver, preserve their ability to provide caregiver, to provide respite so they can maybe take a little bit of a break. So from providing that care to their loved one. We also have a gap filling service that maybe can help with some emergency expenses that will assist that caregiver to provide continued family caregiving to their loved one. So the caregiver support program basically, as I said, was incorporated into the Older Americans Act through amendments. And the Older Americans Act hadn't seen any changes to basically its service structure. What back then included nutrition and information and assistance, and other kinds of programs. But members of Congress were actually experiencing family caregiving issues. Mom and dad were getting older, and they were responsible for looking after, starting to make decisions, going to the grocery store, and then actually having to deal with maybe a hospital discharge where the loved one needed help in the home. So that's when that amendment took place, is when lawmakers started experiencing that. And of course, it continues to grow. We estimate, AARP is estimated there's 1.5 million non-paid family caregivers in Illinois.
People need support. People need
support. So this funding is our little bit of funding, it's about 10 million total in federal and state funding that supports these family caregivers, is actually providing that support that will help that caregiver give them the support that they need so they can continue providing that informal family caregiving. And it progresses. And then when it's time to place mom or dad into a nursing facility or long-term care facility, the caregiver advisory program does provide that, some support in terms of helping with that transition. And we too recognize the family who just recently placed their loved one in a nursing facility. We do recognize that they still play a caregiver role. So I always encourage them not to be cut off of the program because of that. We want to be able to provide some support, but there will be a time where we'll probably have to then shift that support to back into the community. But we do recognize that transition.
And that's
So
actually a good opportunity then for family members to understand about family councils and how they can get that support network happening through a family council if their loved one is in a nursing facility. And we have done past presentations on family councils. If you're interested in starting a family council, you can contact your local ombudsman, where that information will be put into the chat on how to contact your local ombudsman. But also you can get on the IDEO, the Illinois Department on Aging website page, and be able to contact that, connect with that information there too. If you want to get a family council going as a continuation of support, if as your loved one's entering into that long-term care community.
So then we also support elder rights as the Adult Protective Services Program. Area agencies play a role in supporting that program. We help in the designation of those APS provider agencies. And then we also play a role in sponsoring the long-term care ombudsman program. And in the case of this, my area agency on aging in East Central, PSA 05, we've sponsored the ombudsman program since the beginning of the ombudsman program. I'm very proud of the work that we do. Other area agencies may contract it out, but we certainly see it as part of our core.
So that's what, when you look
Yeah.
at that list of ombudsmen, sometimes you'll see that it might be Legal Aid Chicago or Catholic Charities. And that just means that the Area Agency on Aging just contracted those services out to another entity. So it is set up the same way the AAA has, the Area Agency on Aging has that opportunity to either hold the program in-house or contract it out to another entity. And some area agencies on aging do that. So that makes sense.
So, I mentioned that there's these core services like nutrition, caregiver. Now we also have this opportunity to expand in health and wellness. So we have a healthy aging venue of programming. So we have Matter of Balance, which is fall prevention. We have chronic disease self-management and diabetes self-management. We have Bingo Size, which is an exercise program utilizing a bingo format, and Aging Mastery, which is learning more about the aging process and how we can optimize that. And these are more pockets of healthy aging evidence-based programming in our area, but every area agency on aging has some form of a health and wellness program.
And do those look like programs at a community center or some sort of outside entity? Is that what they look like the Matter of Balance or the Bingo Size?
So they're usually classroom instruction, meaning they have to meet a rigorous evidence-based fidelity model. So there's maybe 5 or 6 classes, and they always try to then schedule through all the proper training and all the proper fidelity management. Then we always encourage them to work in senior centers or community centers. Or I've known that some of these programs have operated in long-term care facilities. There's also opportunity to work with local community colleges. So it's many different ways, but it is a challenge for us to make sure that we communicate the availability of these programs. And our colleagues' age options, they kind of serve as control central in keeping up to date on what programs are going on across the state. And that would be that telephone call to age options would be a good place to start, maybe to find out about evidence-based healthy aging programs in your area. Then there's also a combination of different supportive services that it may vary from area agency on aging, like transportation. Some area agencies provide support transportation. Some of us do not because the Department of Transportation funds. But every other area agency provides information and assistance and legal services. And then they support all the case management that's out there and in-home services like in-home services and adult day services under the community care program. So that kind of gives you a little bit of a taste in terms of the services that we fund.
There's a lot of services that the Area Agency on Aging, and it feels it feels holistic to me. Anything from healthcare to caregivers to support to being able to make sure that people are getting meals. So it feels very holistic, that all areas of somebody's life is really being looked at critically to make sure that we can continue to provide support at that local level.
And thank you, Lee, for bringing this, because I kind of glossed over nutrition, and that's about as important. Our performance outcome for nutrition in East Central Illinois Area Agency on Aging is making sure that we improve the food security of an older adult. As simple as that.
Yeah.
And so with that, we have really worked in a creative way with our nutrition providers to identify, and ARPA, American Rescue Plan Act funding, has allowed us to do it, to be able to provide a second meal to an individual who has been assessed as being high nutritional risk.
Mm.
And so again, to really be serious about how we want to address the health and wellness of an older adult on our nutrition program, and a second meal is one of the ways that we've been able to do that through like a very structured assessment process. So we're and nutrition is, and our congregate nutrition program is like the meals at the senior center, and the home delivered meal program is a meal that's delivered to the home of a homebound individual. Yes, our home delivered meals do outpace congregate, but congregate is coming back after COVID. So so that is a program that we support and work very hard to respond to the needs of the older adults. So thank you for
And I know
making sure I covered that.
I know as we were coming out of COVID, that those home delivered meals were such an important piece for people, because it just sometimes even just gave some contact to an individual who was very isolated. Just to see another human being at their doorstep was so not only did it serve the purpose of providing the meal, it also did provide that opportunity for some contact with another human being, which I think was so important. And I have heard that from family members as I've talked about such the importance of the congregate meals or the Meals on Wheels programs, how it makes them feel more at peace knowing that their loved one is getting that meal and feeling like, there is that community support that's happening around them. So I think it's a very reassuring program and such an important entity that the Area Agency on Aging are really helping with.
Hey, this is
So
Karen. I was wondering if you could briefly describe some of the clever pivots that you guys came up with when we were all locked down on COVID, because I know that was just a massive undertaking for the area agencies on aging.
Karen, you read my mind, because when Lee brought up COVID, of course, we lived every one of those days, didn't miss a day of work, and our aging network did not skip a beat. It was phenomenal how they were able to keep those, like, pivot from congregate meals directly to home delivered meals in one day, and to be able to do that and respond to the demands, because it just grew exponentially. And we had wonderful support from the Department on Aging, in terms of easing back on some regulations, and the Administration for Community Living, kind of our federal oversight agency. But what it did come down to, that local network that was able to get those volunteers in place and get those meals delivered, and to get making sure that all the levels of services, all those core services, were still provided. And that's when the advent of Zoom counseling, Zoom contacts, information and assistance, shift counseling happened via Zoom. And again, our aging network pivoted right into that. It wasn't, maybe not every single older adult responded well to Zoom, but we certainly made a big dent, and many people did receive services through our aging network, through these virtual platforms. And then we were able to add funding to support the event. And then we had many of our senior centers and information and assistance coordinated point of entry that actually set up like grocery delivery systems and working then with local faith-based volunteers in helping with, again, the provision of services. We were just grabbing at ideas and going with it, and we were able to fall in line. And the services, the demand for services just grew in so many of our programs. Some of them we did see a reduction in our caregiver program, in some reduction in our evidence-based, like matter of balance classes, those face-to-face classes. But what it made us do is think how we could do it virtually, safely, but virtually. So that was one major pivot many major pivots that we took on. And then we supported the ombudsman program in doing what they could to reach out to their residents, because that was where the social isolation was occurring, was during COVID in long-term care facilities.
And that was the birth of why these meetings happened. We did this, we started these meetings 3 years ago, next month, because of that social isolation, and also the need for people to have information on a steady basis, particularly in regards to visitation, what was going on, what was happening with the COVID rules. There was such a void in the public knowing the reality of what the regs really were saying and what some long-term communities were telling them, and making sure that that continuity was happening across the state, as was being governed by the federal government and Illinois Department on Public Health at the time. So that was the birth of these meetings as well, through the Zoom platforms. So, Karen,
And I know that different people have very strong opinions about immunization, but I wonder if you could just briefly discuss how the area agencies support individuals who need information about immunization.
So that really was launched in 2021, where we really received a lot of funding support, and again through the Department on Aging. Plus, it was the right thing to do to be able to really make immunizations available and accessible. And that was at the time when, you know, there was a lot of restriction with the first generation of immunizations, and then the locations were limited. So we worked very hard to make sure that either we worked with community centers like the ARC here in Normal, Illinois, where they served as a vaccine site and collaborated with public health, with the local public health department, and then worked with Faith in Action and making sure there was transportation. And they went all through the county to bring people in to get vaccinated. That was replicated in many places across the state. I know in the Chicagoland area, there were many vaccine sites that were sponsored by area agencies on aging. But it was a lot of moving parts, but everybody working together. Local health departments certainly playing a very key role, and they were swamped. Even trying to get an appointment back early on was a dilemma for us, because not being able to talk to somebody at a health department. And so we actually trained staff, or provided funding to support staff that would actually make the appointments for the older adults, so they could navigate, you know, the answering system through a public health department. That was short-lived, but that was certainly one way to help make it easier for an older adult. So you know, there were thousands of vaccines that were that the Aging Network and area agencies on aging assisted in people getting, and then did what we could to make sure that nursing home residents, of course, they were always first on the list, and you had some very powerful pharmacies that made sure that happened. But we saw them as part of our community, and monitored that to make sure that was happening as well.
Wonderful.
So a couple of other programs that we support is SHIP, Senior Health Insurance Counseling. Think of the Medicare Part D plans. That's a big part of what area agencies do under their information and assistance and coordinated point of entry role. Then we also have a Veterans Independence Program, where we do work with veterans in working in setting up in-home services. And then we do we participate in Senior Medicare Patrol. Think of it as a Medicare fraud informational campaign, making sure people are aware that Medicare fraud exists and how to combat it. So I would be remiss if I didn't include them. And then we were talking about reducing social isolation.
If you could just back up for 1 second,
Sure.
Susan. The SHIP, I don't think a lot of people truly understand what SHIP is. I have people ask me this question, it's like, what is the SHIP? They don't understand it. If you could just speak to what that
Very
is.
good. I'm happy to. Senior Health Insurance Program, the simple explanation is helping select a Medicare plan that saves you money, and then Medicare Part D plan that really reflects the medication that you're taking. So that we have staff that are SHIP trained who are responsible for going over the different plans and helping that older adult make the decision on which plan is the best choice. And there's a lot involved in the training of this. They're not SHIP counselors are not in any way they're prohibited from recommending one plan or the other. And SHIP counselors cannot be insurance salesmen. That is a conflict of interest. So it has to be objective. But they're very knowledgeable of the plethora of the of all the different the adjacent Medicare plans. What am I trying to say? The plans that cover the deductible of Medicare. And then they know about all the Medicare savings to help save an older adult, save an older adult money through either a Medicare savings program or limited income programs. And then again, back to Medicare Part D plans, making sure that they pick the plan that covers their medication and is the most logical and most pragmatic and most effective for them. So there's a lot of time.
I find this is such a valuable resource for people because many times people are getting solicited by some entities that have some skin in the game. And so they're trying to sell their product. But this is such an independent entity to really walk you through, and you're getting trusted answers. You're not getting somebody trying to sell you something. And I just feel that it's such a valuable resource for anybody that has any of those Medicare issues, questions. Go to them and really utilize this amazing service that is being offered. I just don't think many people know about it. And if they do, they feel like, oh, well, I'm not eligible because I'm not on Medicaid. It has nothing to do with that.
Medicare,
can call that as long as you're 65 years
and
older.
then it is all area agencies on aging have some connection with SHIP. So either they provide the service themselves or they fund a network to support and provide that service. So those numbers at the beginning of this graphic will get you right to where you need to get to find a SHIP counselor.
And Karen put the information in the chat as well so that people can link to it through there. And it's also on the Illinois Department on Aging's website page. It's all over. You'll see it all over that the website. So that's really great information. Thank you for explaining that.
So one of our statewide initiatives, the statewide initiative that we've been operating under for 6 years now, is reducing social isolation. We talked quite a bit about that. But we have actual funding through the Illinois General Assembly and funneled through the Illinois Department on Aging, where we've been able to come up with pilot projects to reduce social isolation among older adults. And back when we launched this program, AARP study was all over the press. AARP estimated that nearly 1 in 5 adults 65 years of age are socially isolated, and that they also reported that social isolation being as bad for health as smoking 15 cigarettes per day.
Wow.
And then our National Surgeon General also has identified in a report the health impact of social isolation. So that too is an added, messaging, the importance in tying together health impact and social isolation. So area agencies were given the opportunity to be creative and establish pilot projects to help reduce social isolation. And we, our pilot projects have served about 250 older adults in our 16 county area. Much more, many more are certainly socially isolated, but our pilots are limited to be able to serve that many people, but we always try to improve their funding. But the pilots, we're utilizing a smart speaker program where the Echo Show is actually being used to help an isolated older adult communicate with family members.
Wow.
Not through the phone, but through a smart speaker program, through Alexa, and to be able to and go beyond maybe communicating with family members, but also maybe communicating with friends and have a group chat. I mean, and we have actual service, we fund service providers that help with training and feeling comfortable with this new technology. And we never would have tried that, unless it was, we didn't have, if we didn't have the special grant, we would probably never have tested that particular technology, the Echo Show, that's probably evolved into something more, a newer version, but it has proven very successful, and it's very economical to utilize, because so that is the Echo Show was also something we wanted to test in long-term care facilities to see if there was a way we could work with our regional ombudsman program and see if we could work with a facility in utilizing Echo Show, especially during COVID, to see if there would be a way to improve social isolation among older adults using that technology. And we were willing to work with the facilities. It didn't really take off like it did in the community, but I'm not giving up. That is, I think a program here to stay. And then we also fund a friendly visitor and friendly caller program, which friendly caller was, of course, very popular during COVID. Now it's morphing back into the friendly visiting program, which, that basically is reducing social isolation, just visiting with friends and family, So that there's a lot to be said about focusing in on these programs that are quite simple in nature, but have had a major health impact. And we actually measure the impact, the performance outcome of these programs through a UCLA loneliness scale, and the loneliness scores have actually gone down.
Wonderful. Yeah, I know actually a cute story about a long-term care community that did utilize an Echo Show in their day room area, and the residents actually loved it, because one of the stories that an activity director shared with me at one point was, so our residents, we had a high Polish base residents that lived in our community, and the residents would just abstractly say, play a Polish Christmas carol, even it might have been in the middle of the summer, but just because it would bring back those memories. And Alexa would start playing some Polish Christmas carols. So the residents that lived there started really using it as a tool to be able to bring back some memories, just engage with each other. Oh, this is that song that we used to sing, when we were having dinner, or, just sharing some memories with each other, independent of a worker having to be with them and lead that program. So I thought that was just such a wonderful idea to be able to utilize a technology to help enhance people's lives.
Wonderful. And while we're talking about Alexa, my Alexa just started here, so I'm gonna have to tell Alexa to stop. Alexa, please stop. Thank you.
That is so funny.
That has happened because I'm working remotely.
Yeah.
That's happened a few times. So yeah, I love that story. I'm gonna have to share that with Angie. I'm gonna have to share that, because look, because there's so much activities that can be just is already naturally programmed within this technology that we can really benefit from. The residents can really benefit from. So I love that.
Yeah, joke of the day. It's another great way to use it. Alexa, give me the joke of the day,
And in no way are we recommending that technology replaces human contact. It's not that. It just enhances the engagement, and we do support that.
Yes.
So the other part of what area agency is doing in our planning is we have to keep a lookout on our aging population. And in very few short years, 1 in 4 Illinoisans will be 60 years of age and older. So are we ready, as an aging network to respond to the needs of older adults who, are going to need home delivered meals, caregivers are going to need more support, healthy aging programs, they're going to catch on, they will only continue to grow. And then legal services, and then all the creative programming. So we are always challenged in making sure that we have the resources we need to keep these programs going. Back to that advocacy, back to communicating with Congress, back to communicating with the Illinois General Assembly. These are your neighbors. These are the people that vote you in. That we need to make sure that we have services that will respond to the needs of these older adults, and that means funding.
And those services are so needed. I just, that matter of balance, I shared with you earlier that I had been trained on matter of balance myself. And it's such a great program because not only does it make you feel like you're working towards a great health end for yourself to keep you from falling, but also it gives you, there's also socialness to it because you're usually engaged with other people while you're doing it. It's like working out at a workout class. But it has that piece to keep you healthy from falling, but also it's a program. I mean, it's tough. It's good. It's great exercise. It's not this, little, let's just move your hand. It's great exercise. So it serves a really good purpose.
Oh, yeah, there we go. You're the spokesperson for that. Wonderful. I think I also need to just share area agencies, all of us, across the nation, and there's about 640 area agencies across the United States. We all are responsible for targeting a vulnerable population. Even though the Older Americans Act is not means testing, meaning you cannot, there's no financial eligibility or asset eligibility for our Older Americans Act program. Some of the other state programs there is, but not Older Americans Act. So, anybody 60 years of age and older are eligible for these programs. However, we do have to target, and the way I look at it, if we only had one meal left to go to one person and there are 2 people in line for that, we would have to choose the individual that was low income minority, or fall within these vulnerable populations, as opposed to the person that might have more means. So, we spent a lot of time talking about the importance of targeting, and our numbers our penetration rate is pretty great. So we're very happy about how all of our agencies have done a great job of targeting. But those categories are low income, using the poverty guidelines, ethnic and racial minority, limited English proficiency, people in the rural areas, and then individuals at risk of institutional placement.
Now, how do you grab your data for this? How is this coming through the census when we do those census? Our census for Illinois, we fill out our census.
It's a good question. So we cannot rely on the census as us going on the website and figuring all this out, because our population is 60 years of age and older for older adults, whereas many of the census tracks have that benchmark of 65 years of age and older. So the Illinois Department on Aging, they actually work with a consulting firm to be able to actually extract 60 years of age and older. And then they use the census to be able then to match everybody 60 years of age and older, all the way up to over 100 years of age. Then they're able to extract then those that are low income and ethnic and racial minority based on census data. So we would be doing ourselves a disservice if we did it on our own. We do have to rely on the department. And the other part of these categories, these demographic categories, are used to actually allocate the funding to area agencies on aging. It's used in a funding formula.
Got it. So there was a
Yeah.
question that came up in the chat, and someone asked, what if a senior falls within all those categories?
Well, they would be number one to target because there are, yeah, and the area agency on aging better make sure that we serve that client. Yeah, yeah. So and we have seen this. We have seen this.
Mm-hmm.
You know, in so that yeah, yes, that would be the highest priority client that would come across our roles.
Wonderful.
So then moving on, area agencies on aging. This survey was a while ago. I'm in the process of surveying our area agencies on aging again in preparation for a legislative reception we're going to have in April. But I said to Lee, I was able to update a lot of the data, but this one I couldn't get a survey done. But it just shows you though, just how many employees back in 2018 were employed by area agencies on aging, FTEs, 228. And then how many actual businesses receive funding through area agencies on aging. And based on that one, I was able to update based on a report that we did to the department. That's 551 who also has employees. And then the estimated number of employees funded by Illinois area agencies on aging. So this particular graph just shows the economic impact. You know, sometimes there's this notion that we're just a drain on public resources. All we do is take, you know, federal money and state money. But the Older Americans Act and the Illinois General Revenue Funds to support these senior programs, you can see we're contributing to the economy. And we also, it's not a total governmental handout. It does require a local match, meaning you raise local funds to support, and you also give the older adult the opportunity to donate. So
great.
So then we served about 406,000 older adults in Illinois during 2022, about 14% of the population. Now, we have been up to over 500,000. There was an impact on COVID in terms of our unduplicated numbers because, like I said, those evidence-based programs, some of the caregiver programs, some of the senior centers closing and maybe not pivoting as quickly as we thought, you know, we were doing. So this was always a surprise to us. And I think the other part of this number at 406,000 is we've kind of refined our reporting mechanism. So this is unduplicated senior citizens in Illinois, but you know, that's still a sizable number when you compare it to the Department on Aging's community care program, which, you know, is more like 90,000. This is 406,000 older adults being served by the Illinois Aging Network, which is the area agency network.
Wow.
And then being able to save about $21 million in cost savings if you were to equate how much it would cost per day in a long-term care facility, that of those 406,000 people, thinking 25% potentially could be at risk if they didn't have those supportive services. It equates to about $21 million in cost savings to the taxpayer as well as to the older adult.
So not only are these great, amazing local programs happening, it's also ultimately saving us as taxpayers in the state of Illinois by providing these services and care and giving jobs to people who live in our communities.
Jobs, yep. And then here's another example of cost benefit. Our home delivered meal program, it costs about $2,600 to provide a meal every day, 365 days a year. And this would have been back in 21. That would have been the average cost for an entire year of a home delivered meal versus 1 day of hospital care at $2,700, compared to a cost of 10 days on long-term care facility at $2,000.
So it definitely is that cost saving piece. You can really see that there. And as we talked about, the meal situation is very important for people. Wonderful.
So that kind of gives you the synopsis, a snapshot of what we do. Now, I'm going to go back to that very first slide, if that's okay, Lee, just with all these numbers and the map, to see then if anybody has any questions. Plus, Lee, if there's anything in particular I missed, I'll be happy to cover.
Okay, yes. Well, this has been extremely informative. And I see myself referencing this off to people with through the YouTube video when people have questions. I think it's a really great, people need to hear this. So, Susan, we really appreciate you taking the time today to share this with us. I feel that this is a very empowering conversation for people to hear. If anybody has any questions, please feel free to unmute your mic. You can, whatever, if you'd like to do that, that's perfectly fine. There was a question regarding the personal needs allowance that was asked earlier. And the question was, if I could find it, was if it took away from money to people, to the bottom line of a nursing home, did that affect the nursing homes? And Karen gave an answer within the content, gave a lot of information with that. So the question was, did the increase of $30 to $60 result in reducing the amount paid to long-term care facilities by the $30? And Karen, do you want to open up your mic and explain that to people?
Yeah.
The personal needs allowance is something that is authorized under both federal and state law. And it is an amount that the individual gets to keep to pay for various incidental personal costs. $30, as we all know, just is very, very lean with how inflation and technology desires have increased over time. So this is a wonderful benefit to individuals who are living in a facility, but it doesn't impact the payment to the actual facility itself.
Yeah.
And I
So
do
I think
have another question for Susan. I may have missed it when I was adding things in. Can you briefly explain information, INA, information and assistance?
Absolutely. Oh, wonderful, wonderful. Thank you for that, because that's one of those terms that's just kind of nebulous out there. And we're trying to do a better job of messaging our services. Information and assistance is a service where you provide information about available programs and services that could benefit older adults. And then we also help that older adult apply for those benefits and services. So it could be just information about where the nearest home delivered meal program is and giving a number, but then it could actually then be, you come into the office, let's talk about what all the different needs you may have. It gives the older adult an opportunity to learn about all the different programs, the benefit access applications that help with reduction in license plate fees is a big activity. All the SHIP activities, meaning the Medicare supplement discussion, would be under our information and assistance program. Helping with navigating a Medicaid application, being able to navigate transportation, knowing that it continues to be one of the number one needs of older adults, but the transportation programs are spotty at best. And so there is, that it's that entity that information and assistance can cover so many different programs and services. It is, we call it also a coordinated point of entry in East Central Illinois. And the coordinated point of entry, for that, we call it that for that reason, that older adult may present with one problem, but our information and assistance, our senior information and assistance providers then know to be able to ask other specific questions of that older adult to see what else that they need. So we're more comprehensive.
No.
So
And
this is
not
a separate
not
doorway than, so this is a
Yes,
separate doorway than the care coordinators.
It is, and the care coordinators also may look at a client more from the point of view of what help they need in the home.
Okay.
I know there is the approach that they are comprehensive, but sometimes maybe our coordinated point of entry SIS providers who work in conjunction with the CCUs, but they do look at things maybe not from a financial perspective. They look at it from the point of view of how comprehensive and holistic can we be to serve this older adult to help them remain independent.
I just want to make sure people know that it is okay to use the many different paths to get assistance that they may need for themselves as an older adult to live independently, or that they need to find out more information because they're concerned about someone that they care about and they want to get that person the help. And you're not taking anything away from anybody by asking. You're just doing a benefit that improves everybody.
Mhm. So if
And
I
that
just for clarification, if I was somebody who was either in the hospital and being told you should go into a nursing home, but I'm like, I don't want to go into a nursing home, I want to go home and I want to see what services I have there, or I'm in a nursing home and I'm being discharged back to home, I could call my area agency on aging and ask if they have any services or anything within the community that could assist with once I get home. Like I could arrange maybe at that point to see if I could get Meals on Wheels, or if to get myself out of the house, I could go, where's a congregate eating place so I could go have a meal there. I can make that phone call to help with my discharge planning, whether it's from a hospital or from a nursing home, to make myself utilize what's out there and not feel like I'm going home to limbo land and having no clue where things are going to come from.
And you know that there's nothing that would prohibit someone from doing that. So that we would encourage that kind of empowerment. And there's another role that the information and assistant providers do. It's called options counseling. And this would be, kind of planning for when the time comes, as Karen described, when I need services. But the options counseling is a little bit more of in-depth counseling with the client in terms of, if this happens in this stage in your life, what do you want? How do you want to go about in terms of obtaining long-term care, and in long-term care meaning maybe in-home support services and maybe private pay and how that will come into play. Is there long-term care insurance? So it's a little more in depth, and there would be a care plan is established during the options counseling. But again, comprehensive, holistic, and not financial based. So yeah, that would be an opportunity for a SIS provider. We would probably want to include the CCU to be involved in some of that because of their role in terms of determining maybe other support systems, but a SIS provider could certainly add a more comprehensive, holistic layer to that service as well.
Well, this was absolutely wonderful, Susan. Thank you so much. At this point, what I'm going to do is I am going to stop the recording, but I do want to just thank you again so much.
Thank you.
And we will be opening up the mic. So I'll just thank you.